Thank you. I would like to start my presentation to saying that it's an honor for me to share this symposium with Professor Leocadio Rodriguez Mañas. And I'm going to get advantage of this moment to thank Leo for having been my mentor 20 years ago back in Madrid during my training in geriatrics. And I learned, and you taught me what geriatrics is, the real geriatrics. And you shared with me your passion, your love with research in our specialty. And that's why I'm very, very grateful. So I would like to start by that. And it's an honor to say today that we are colleagues and even friends. So today I'm going to share with you, I'm going to start by just a brief summary of ICOPE program, even if Leo has said already one word or two. Then I'm going to share with you the implementation of this ICOPE program in clinical practice in France, and then to end by showing you some data from the participants from this program. So very fast, in 2019, WHO published the Integrated Care for Older People digital program, had guidelines, and as just has been said, rather than focusing on a disease, this approach emphasized the optimization of intrinsic capacity as the key of healthy aging. In other words, maintaining our function in order to be able to continue to do what we value. So ICOPE care pathway is based on the assessment and monitoring over the time at regular intervals of the 6 core domains of intrinsic capacity, so Leo just said, locomotor capacity, vitality, vision, hearing capacity, cognitive, and psychological capacity. To do what? To improve, maintain, and slow declines in intrinsic capacity and to build resilience. So I see intrinsic capacity contract differs by being framed as a dynamic continuum, and its trajectory can potentially be monitored across the life course, leading, and that's the major point of all this story, leading to early detection, assessment, and early intervention. So very briefly, this ICOPE pathway, it's been created to be implemented in primary care and propose 5 steps. First one, screen for potential losses in intrinsic capacity, then to assess in greater depth, searching for conditions associated with this loss of intrinsic capacity, such as underlying diseases or social and physical environment. Then the step 2 will lead to a personalized care plan based on the person goals and with a multi-assessment for a multidisciplinary team with proposing multi-domain interventions. Then the step 4 will ensure referral pathway and the care plan monitoring over the time. And the step 5 is a cross-section phase which engage community and support for caregivers. So this is the step 1, the ICOPE screen monitoring tool, which is a very fast, easy tool to perform. It lasts around from 10 to 15 minutes, and with a very simple question, a very simple test. And if a positive screening in one or more domains, then the step 2, the greater depth of concern IC domains will be performed. So in France, since January 2020, the Gérontopôle of Hospital University Toulouse from France, which is a WHO collaborating center, is implementing this or trying to implement this ICOPE program in clinical practice with a financially supported by, in one hand, by the French Health Ministry, but also by the Health Region Agency, ARS, because this program is implemented mainly in the Occitania region, which is a southwest region of the country. So these programs target the autonomous seniors, 60 years and over, community dwelling, so we really target robust, pre-frails, and frails older people who can participate, everybody. When I say everybody, it's everybody, of course, all the health professionals, community nurses, general practitioner, pharmacists, physiotherapists, nutritionists, dietitians, but also the senior, the other people himself, his family, proxy, and also home professionals, which are not health professionals. We're in primary care, and ICOPE program uses digital tools to implement this program. So to do this, we have developed 3 free digital tools. The first two one, the ICOPE Monitor mobile application and the ICOPE Bot chatbot. They are digital tools in order to perform the initial and the follow-up step 1, the screening tool. These 2 tools can be used in a professional version, but also in a self-assessment version for older person or proxy family. The third free digital tool is the Frailty ICOPE Secure Database, which collects all the step 1 performed, initial and follow-up, but also allows free and easy access to all health professionals to allow to remote telehealth follow-up and monitoring of seniors' intrinsic capacity over time, but also allows to recall all the step 2 performed with these patients. So this is like a global, general, schematic pathway that we implement. So as you've seen here, all these step 1, initial and follow-up every 6 months, they are performed thanks to these 2 digital tools by health professional, trained health professional, senior himself or family. Every single step 1, they are going to arrive, they are collected in this ICOPE database. And whenever one of the questions, items for the step 1 is a positive screen, so the database generates an alert, okay? And this alert is processed by a remote telemedicine platform by trained nurses that are going to analyze, because they call the older person, they're going to analyze if this alert is clinically significant, and if it is, they're going to refer to the senior general practitioner, which the GP is going to activate the step 2 in order to assess more deeply and to propose step 3, a personal care plan. This step 2 and step 3 can be performed by the GP himself, but also, and most of the time, it is performed by trained primary care nurse and other trained health professionals that have been trained in geriatric standardized assessment. So in our opinion, there are 3 associated factors to ICOPE program implementation success in Occitania. Firstly, the training. The trained and supported of health professionals. We have developed different training tools, like a new e-learn platform, very nice e-learning platform, which is free for everybody. You can go to see it. And today, currently, more than 3,000 health professionals have been trained, as follows: almost half nurses, followed by physiotherapists, pharmacists, and physicians, and other. The second factor is all the communication actions addressed to seniors, to other people. And the third, it's all the partnerships that we have developed with different institutions and community associations, because it's a problem which has had to be implemented in primary care. So here, I present to you just some data from the database, data from January 2020 to May 2022. So by that time, 18,572 seniors joined the ICOPE Care program with a mean age of 75 years. Most of them, more than 60%, were women, the majority from Occitanie, and 12%, they performed their step 1 in self-assessment. The rest were performed by professionals. The most digital tool used was the ICOPE monitor. So here you can see the first step, the step 1 initial screening results. And as you can see, 92.6% of all these participants presented at least a potential decline in one or more intrinsic capacity domains. And as follows, here you can see as follows, like more than 60% vision had a potential decline in vision domain, 56% cognition, half of them in addition, 39 in psychologic domain, 33 in mobility, and then almost 1/5 in nutrition domain. So I'm going to, because we don't have time to show you all the domains, but I'm going to focus on nutrition domain and cognition domain and show you some data from this. So as Leo just told you, for WHO, the vitality IC domain includes metabolism and energy balance. So that's why the handbook ICOPE proposed to focus on the one major key that decreased this domain in IC, which is malnutrition. So you can see, I'm not going to talk about this, but you can see the whole assessment and management from screening to intervention that ICOPE proposed. So this is some data from the first step 1 initial test. I remember you that almost 1/5, 19% of these participants had a potential decline in vitality, nutrition, and you can see these are the 2 questions that we asked to the senior in the step 1, and you can see that 13% of these people, seniors, presented an appetite loss, 11% weight loss, and both just 5.6%. About cognitive domain, the same. ICOPE handbook proposed the whole, from screening to the classical assessment cognitive capacity, okay? But also they really insist in the assessment and management associated condition, like malnutrition. Also, the assessment management of cardiovascular diseases and risk factors, and of course, all the social and physical environment. So concerning the data from step 1 initial, I remember you that more than 50%, 56% were a potential decline in this domain, and 32% had a subjective memory complaint. So one of the questions said, do you complain about your memory? Yes or no. And 42%, they presented objective memory impairment. I remember you that it's the full orientation in time and space, and also we use the 3-word recall from the midi-mental state examination. Here, I show you the step 2, the assessment grid step 2. By the time in May, we also recorded, because it was a problem with the digital tool, we also recorded almost 1,500 step 2 performed in this population that I showed you. So as you can see, the mean age was almost 80 years old. You can see that, this is very interesting, that ICOPE really targeted this population. And 80% they were or pre-fail, almost half of this population, and frail in 29%, of course 20% for robust. Concerning the nutritional status also, I think it's very interesting to see that ICOPE is capable to identify almost 25% of people with risk of malnutrition and 5% of malnutrition. And this is the mini-mental, so you can see that we have almost 25 mean of score in mini-mental state examination. So this is the step 3 that followed the step 1, and you can see that the mobility domain concerned the majority of recommendation in 80%, okay? But they was followed by nutrition and by cognition recommendations. Concerning nutrition, these recommendations were as follows: nutritional counseling, weight monitoring, 30%, 20% fortified diet and oral nutritional supplement, and referral to dentists in 8%. Concerning cognition, the recommendation, they were nutrition and physical counseling, cognitive stimulation, exercise, and in 16% they were referred to memory concentration. This is some data because we wanted to see at the baseline data, we wanted to see if participants with a potential decline in vitality domain without no other domain touch or screen, and to study in this population the incidence of other potential declines in cognitive, in intrinsic capacity, other domains, okay, other than vitality. And when we looked at the vitality domain, what we can see, this longitudinal analysis were adjusted for age, sex, and weight. And we can see that appetite loss at baseline is longitudinally associated with potential decline in psychological mobility and cognition domains at follower, which underlines the need for integrative approach, not only one function, and the multi-domain intervention. But this is even more significant when we look at the cognitive domain. When we look at the cognitive domain, the subject complaint, the objective complaint, and even the both, they are more stronger associated. And this potential memory impairment at baseline is longitudinally associated with potential decline in mobility, vitality, and psychological. So this is even more evident for the need of this integrated approach and the interest for multi-domain intervention, so the step 3. And this step 3 will lead to the step 4 that will ensure all this continuum of integrated management and plan monitoring over time. So this is my key-home messages. So ICOPE approach seems to detect early deficits in intrinsic capacity nutrition domain by step 1 and then step 2 in robust, pre-fail, and frail seniors, allowing an early intervention by step 3 to prevent malnutrition and all its devastating health-related negative outcomes that we all know. ICOPE approach enables to identify older people with mild cognitive impairment and to contribute to prevention, early diagnosis, and early intervention. France experience shows feasibility of the ICOPE care program implementation in primary care, clinical practice, using digital tools and setting up a new prevention care pathway. Integrative approaches and multi-domain intervention is better that only one IC domain assessment due to the links between these different domains of intrinsic capacities in older adults. And finally, ICOPE program allows early detection of declines in intrinsic capacity, including nutritional and cognitive status, and allows to implement fast and personalized intervention to prevent loss of autonomy in seniors 60 and over years old. So I would like to associate, this is the most important slide, I would like to associate all the team from the Age and Disability Prevention team for the Gérontopôle, and it's thanks to them that today we are more than 22,000 seniors that participate in this program currently, and I would like to thank you.
Thank you.